Thank you, Madam Speaker. Honorable Prime Minister, members of the August House, our visitors in the gallery, Nisambula Vinaka, and a very good morning to you all. Madam Speaker, I rise in support of the 2017 and 2018 budget in this August House. Madam Speaker, the budget that was presented by the Minister for Economy on Thursday, 6 July, is indeed a people's budget. A people's budget, forward-thinking, forward-looking, all-inclusive, and not leaving any Fijian behind. Madam Speaker, like the Honourable Shadow Minister for Economy said, Father Christmas came early. It is good to note that the Honourable Randurandro agrees that Christmas came early through this budget. Christmas, Madam Speaker, is a time of sharing joys and brings good tidings to the people. So I thank Honourable Randurandro for saying that the budget did bring joy and good tidings to all the Fijians, and indeed a time to celebrate. I'm excited, Madam Speaker. Madam Speaker, on another note, Honourable Randurandro did mention a few things which I'd like to draw the attention of the House before I move on to my address. He mentioned something about the sugar industry, and he did mention something about Rarowai Mill in Ba. Honourable Madam Speaker, I come from the farming district and also own a cane farm. So I can tell the honourable members from the other side, Rarowai Mill is in Ba, and it is fully operational, and the mill in question is Penang. And so if the opposition cannot get the name of the mill right, Madam Speaker, with an economist, with a cane farmer, and the Shadow Minister for Economy on the other side, one can only wonder what they will get right. Madam Speaker, as expected from the opposition, the Honourable Shadow Minister for Economy speech has nothing positive to say about this budget. It is simply an ongoing case of lost logic for the members on this side of the House. Madam Speaker, coming to the Ministry of Health and Medical Services, as a Minister, I warmly welcome the budget, and I thank the Honourable Minister for Economy for our Ministry's allocation for 2017 and 2018. Madam Speaker, the Fijian Constitution enshrines health as a fundamental right for all our citizens. Consequently, my ministry, the Ministry for Health and Medical Services, is responsible for ensuring that all Fijians have access to reliable, quality health and medical services, regardless of where they're residing. I am pleased to report to the members of the House that through the 2017 and 2018 budget, the Fiji First Government has delivered an increase of over 77.2 million, almost one-third in the Ministry of Health and Medical Services budget. The total budget for the Ministry of Health and Medical Services is 321.2 million, comprising of 251.6 million for operating expenditure, 56.7 million for capital expenditure, and 13 million in respect of that. In addition, a total of 66.5 million is being provided by the Ministry of Civil Service to fund our doctors' salaries and training. Madam Speaker, that means an overall health sector budget of 387.7 million. Madam Speaker, I know when we talk about healthcare, we often focus on the work that our doctors and nurses do every day in hospitals, health centres, and nursing stations throughout Fiji. But we must not overlook the vital contribution that ministry staff also make in keeping people well out of the hospital. In that context, I draw honourable members' attention to the fact that Fiji now has child immunization coverage rates that are among the best in the world, as high as 98% according to one recent survey. Madam Speaker, what that means is our children are protected against deadly and disabling diseases. Our maternal mortality rate, mothers dying during childbirth, was lower in 2016 than at any time during the current century. The rate of amputations for diabetic foot ulcers reduced by more than two-thirds between 2011 and 2016, a reflection of better care and support for people affected by diabetes. 5 out of 6 girls in year 8 are now immunized against the human papillomavirus, which is a major cause of cervical cancer, itself one of the major killers of women in our country. And Madam Speaker, our smoking rate among both males and females is lower than that of most other Pacific countries. Madam Speaker, the Ministry's work in protecting Fijians against diseases, supporting them in their efforts to lead healthy lifestyles, and seeking to eliminate the risk of unhealthy environment is all too rarely acknowledged, but it is indeed vital work, and work with this budget will enable us to sustain and grow. The total sum allocated to public health services in the 2017 and 2018 budget is $8 million, a one-third increase on the equivalent sum in 2016 and 2017. Madam Speaker, these funds will support the work in many programs, including, just to highlight three, enforcement of tobacco control, HIV/AIDS prevention and control, adolescents' reproductive health. Our efforts to build healthier Fiji will also be helped by the 15% increase in excise tax on cigarettes, tobacco, alcohol, and sweetened and carbonated drinks. That is the most welcome move from a health perspective and underlines our efforts to encourage everybody to take more responsibility for their own health and well-being. Needless to say, Madam Speaker, much attention will continue to focus on the work that is done every day in our hospitals and other healthcare facilities. Madam Speaker, for the information of the House, the Ministry of Health and Medical Services is responsible for the operation across Fiji of 3 main divisional hospitals, 2 specialist